Go. All right, good morning, everybody, and welcome to another exciting public vaccination event. We are here today at another one of the City of Chicago's points of dispensing or mass vaccination sites, again in partnership with City Colleges of Chicago. Today, we will be vaccinating 10 individuals who are all part of our Protect Chicago initiative. These are some of the people who are doing outreach work, making sure that people have information about COVID, answering questions, going door to door, really building a lot of that neighborhood outreach work in our most hard-hit communities. And the folks being vaccinated today are associated with the Southwest Organizing Project. So instead of doing individual introductions of each, we're going to just go ahead and move down the line here. We'll start in the front, and then we'll be moving on afterwards to the back. And I'm just going to talk through some of what's going on as we do it. So please move ahead. And as always, we've done a lot. Go ahead. We've done a lot to ensure that safety is in place. So individuals have already registered. They've put in information that allows us to securely keep track of who's being vaccinated. All right. Good. All right. Good. Go ahead when you're ready. We also make sure that in each case, we have asked about any history of allergies, and every individual being vaccinated is monitored for a minimum of 15 minutes, and if there is a history of that, at least 30 minutes. We have not seen an unexpected amount of allergic reactions at all related to this vaccine, but we are ready in the unusual event that that were to occur. All right, great. Moving ahead. Everybody who gives a vaccine here in the city of Chicago is a licensed healthcare worker. They've had specific training in how to give vaccines safely. We pay attention to infection control. You see these red boxes on the table, for example, are how we always put thank you. The syringes after vaccination to ensure that there are no sharps available. Perfect. Thank you. And you can see the speed with which we're moving through vaccines here. The goal in these mass vaccinating sites is to ensure that we can do vaccines safely and efficiently with all of the appropriate monitoring. Thank you. These are City of Chicago nurses doing a lot of the vaccination. We've also pulled in a number of contract nurses, other vaccinators. We have Chicago Fire Department, EMS providers who are vaccinating at some of our other locations. We also have put out a call for volunteers who are licensed healthcare providers and would like to be part of the vaccinating team in Chicago. All right, perfect. So let's give a congratulations to this first round of the 5, and then the vaccinators are going to move over to the back and be working on getting the rest of that going while we get the press conference going. Thank you again, and congratulations.
Okay. All right, good morning, everyone, and thank you all for being here. I want to extend my thanks to Alderman Derek Curtis, whose ward we are in, City College's Chancellor Juan Salgado, not only for his participation and support of our vaccine program, but for everything he does every day to support students in our city, and of course our Public Health Commissioner, Dr. Allison Arwady. I'm incredibly excited to announce Chicago has reached its latest step and a key step in our city's vaccination journey. By next week, Chicago will have a total of 6 new mass vaccination sites to increase distribution. equipped to distribute as many as 25,000 shots every week. Known as points of dispensing, or pods, these sites will expand our vaccine distribution through our current phase known as 1A, which includes non-hospital and other community-based healthcare workers, and extend our reach as we transition into our next distribution phase, 1B, which will begin very soon, and I'll elaborate on that in a moment. Chicago's first pod site opened at Malcolm X College on December 28th, and was soon followed by just this Tuesday's opening at Arturo Velasquez Institute, and yesterday's opening here at Richard J. Daley College. And tomorrow's opening will be at Olive Harvey College, and then next week's opening at Kennedy King and Harry S. Truman Colleges. What makes these sites so important isn't simply their size, but their location. And as I've said again and again, equity isn't part of our COVID-19 strategy. Equity is our COVID-19 strategy. And the location of these sites gives us the geographic breadth we need to reach more and more residents in a safe and equitable way. And I want to reiterate my thanks to the many city employees, some of whom you see here today, who have been instrumental in bringing these sites online and making this moment possible. I also want to thank Team Rubicon and the Salvation Army, and of course the City Colleges itself. As I mentioned a moment ago, we'll be boldly transitioning into our next vaccine distribution phase, known as 1B. And following our initial launch and ongoing distribution of vaccinations to our frontline healthcare workers and residents and staff at long-term care facilities. This next phase will prioritize workers in essential industries, including emergency services personnel, people at high risk for COVID-19 illness due to underlying medical conditions, and people 65 years or older. However, it's critical to remember that just because more Chicagoans are being able to be vaccinated doesn't mean that we should let our guard down. Quite the opposite. COVID-19 is still very deadly, and even if you are vaccinated, you may be able to transmit the disease to those that aren't and potentially spread this disease further. That is why we must continue to be safe and act responsibly. And let me clarify, it's important that folks who get vaccinated get the second dose to minimize any kind of spread by themselves and inoculate themselves. We have to continue wearing face coverings, socially distance, and wash our hands regularly, as well as travel only when necessary and avoid gatherings with those who live outside of our households. More information about this new vaccination phase and ultimately all forthcoming phases will be available at our website, chicago.gov/COVID-VAX. That's chicago.gov/COVID-VAX, which we are actively revamping to provide more clarity for folks about when and where they can get vaccinated. In the coming weeks, we will be building on our success even further by expanding into new vaccination sites, announcing robust communication strategies that will target our hardest to reach communities, and communicating with residents about when they can get their vaccination, as well as other mass sites that we will be rolling out to accommodate the general public. However, for us to be successful as we must be, we have to continue building the trust of our Black and Latinx residents to take this vaccine. I've talked about this before, and I'm going to talk about it continuously throughout this vaccination period. The reality is that many of our Black and Latinx community members are skeptical about getting the vaccine. They're standing on the sidelines. They're waiting. We're calling it vaccine hesitancy. Now, this skepticism is understandable, particularly given the historic and tragic legacy of racist mistreatment and abuse at the hands of our public institutions and the medical community against Black and brown Americans. That's why months ago, we began working closely with community leaders and stakeholders well before we even received our first dose of vaccine to reassure communities about its safety and importance. And we will continue to do so until every single Chicagoan receives the vaccine treatment they need, which is their right. And just so you hear from me, our COVID vaccine is safe, period. I personally look forward to receiving my own vaccination soon. I will tell you from a personal standpoint, I'm talking to my 92-year-old mother about getting this vaccine through her healthcare provider and assuring her it is safe. I'm also having the same conversations with my siblings and other loved ones. I tell them the same thing I tell you. The vaccine is safe. If you've got underlying medical conditions, absolutely check with your healthcare provider, but it is safe and you should get it as soon as you are able. To all our Latinx residents still unsure about its safety, let me just add that it's been Chicagoans like you and me who have not only been receiving the vaccine, it's been Chicagoan healthcare and medical professionals who look like you and me who have been ensuring its safety. And I can say that these vaccines that are on the market now included a large pool of diverse people who were part of the trials. That's why I have so much confidence that this vaccine is safe for us to take. My only wish is that we'd have enough doses to vaccinate everyone right now and finally move forward out of this terrible pandemic and to get our lives and our world back on track. But we will get there. I'm confident of that. Now, with that in mind, let me say again, as I've been saying now for some time, we are frustrated by the federal government's response to COVID-19 overall, but particularly the vaccine rollout, which has not delivered on its promises of the quantities that we've seen. In just the last 2 weeks, we have received less vaccine than we did initially. 2 weeks ago, the number fell to 38,000 first doses. Last week, the number dropped to 32,000 first doses. That is clearly the opposite direction of where we need to be going. At the rate we've been on, Chicago won't be fully vaccinated for another year and a half, and that is completely and totally unacceptable. We must accelerate the number of first doses that we are receiving on a weekly basis so we can get those doses into people's arms, as we saw today, and give people hope and safety that the end of this terrible pandemic is near. We have stepped up for the federal government because we had to. In creating our first-class comprehensive distribution infrastructure. And now the federal government must step up for us. And by us, I mean the residents, not just of Chicago and Illinois, but of the entire country. We need a federal government who is on the side of the people, and the vaccine is the most critical thing that we need to be engaged with the federal government on right here, right now. We need more first doses all across the country. That is the only way that we can get this vaccine distribution process moving full steam ahead, regardless of what the circumstances are. We need that to happen, and we need it to happen now. I want to also take this opportunity to call on the federal government to provide additional COVID-19 stimulus. That is essential. We are all aware of the need to increase individual stimulus checks from $600 to $2,000. But we also need stimulus that supports our state and local governments. When it comes to stimulating our economies, our state and local governments are where the rubber meets the road. We can't recover in the way that we need to if we are not supporting state and local governments' efforts to do everything from vaccinations to making sure that our small businesses are taken care of, that we are providing direct relief to our residents. That's why it's so essential that we need to have federal stimulus. We can't rest until that happens, and we call upon elected officials in Washington, D.C. to make this the first priority of the new administration. Please, we need a federal stimulus package that is deep and wide and respects the role and necessity of state and local governments and the catastrophic effect that COVID-19 closures have had on our local economies. Regardless of the challenges that we face, we still continue, as we must, to move forward on this journey to vanquish this disease, to get our economy back on track, and to bring our lives back to normal. Today represents another important step and milestone in our journey. I want to thank all Chicagoans once again for doing their part in staying safe and adhering to the public health guidelines that have literally saved thousands of lives here in our city. That, more than anything else, has been the key to our success over the past year. and will serve as a foundation for our historic recovery, which will be sure to follow once this crisis is behind us. Thank you all for everything that you're doing. Thank you to the people here today who have shown incredible courage and will be ambassadors in their neighborhoods to assure residents all over the city that the vaccine is safe and that is the step forward out of the terrible place that we've been in over the course of the last year. It is now my pleasure to ask Dr. Allison Arwady to come to the podium. Thank you.
Good morning, and thank you, Mayor. So the 10 people getting vaccinated today here in Chicago are 10 of more than 10 million that have been successfully vaccinated with their first dose across the United States. They're 10 of the more than 74,000 doses that have already been administered here in the city of Chicago. We are making good progress, but I do want to underscore and put a little more data behind the mayor's correct assertion that the main thing we need to grow our operation and be able to move ahead through these phases is additional vaccine. We're hearing a lot of good, promising talk at the federal level. We're hearing the incoming administration talk about pushing additional doses. We're hearing the outgoing administration talk about making all doses available. But here are the doses that the city of Chicago will be receiving next week. Last week, we received just over 32,000 doses of vaccine. This coming week, we're receiving 34,550 first doses of vaccine. 34,550 first doses of vaccine is better than 32,000 plus. But let me remind you that in phase 1A, we have approximately 400,000 healthcare workers who live and work in the city of Chicago. Approximately 40% of the doses that we've been administering to people who don't live in Chicago, which is fine. They work in Chicago, we want them protected. But they actually don't count in our numbers for vaccinating Chicagoans. And we are lucky here in Chicago to have the amazing healthcare system that we have. The reason we are not concerned at this point about hospital capacity is because we have thousands of available beds and the healthcare workers to support those beds. But vaccine has not been allocated based on how many healthcare workers a region has. It's been based purely on population. And particularly where we look ahead to phase 1B, and I know how anxious, especially those over 65, are here to be vaccinated in Chicago. We have 360,000 Chicagoans who are over the age of 65. We have another approximately 360,000 Chicagoans who work in the frontline essential worker categories that have been identified for prioritization in phase 1B. When I think about 600,000 people to vaccinate in that next phase, getting 35,000 doses a week isn't going to be enough for us to move ahead quickly. So I'm feeling optimistic about this. We're hearing good things, but part of the reason we haven't yet been able to fully open is because we have to make sure that every dose is going out and being used, but that the people who are at the highest risk for COVID are getting the opportunity for this vaccine. So the people that we're focusing on vaccinating right now are your home healthcare workers, the people who are going into the homes of Chicagoans who are older and have underlying conditions. They can't keep a 6-foot distance. They're traveling from home to home to home. We need to make sure they're vaccinating. It's our dental providers. Again, think about this. They're not able to keep a 6-foot distance. You can't have your mask on. It is critical that we keep our medical infrastructure as protected as we're able to as we move ahead. It's our dialysis workers. It's our physical therapists. It's our many other medical and ancillary health support that are putting their own safety at highest risk every day for COVID. We have to make sure we can vaccinate them. And so what we announced yesterday, because we also want to make sure that no vaccine is going unused, is that while we are still actively in phase 1A of vaccination, that our priority remains continued vaccination of healthcare workers and residents of long-term care facilities. For those hospitals and outpatient sites that are enrolled as vaccine providers, they need to first continue to prioritize healthcare workers, but beginning January 18th, if they have any unused vaccine, and they have not identified additional Tier 1A healthcare workers for vaccination, they may use unused doses to vaccinate their highest risk existing patients that are over 65 years old. These patients must already be enrolled at these facilities, and we've asked them to prioritize even within that group. Look at your list. Who are the people that are the oldest, have the most underlying conditions, pay special attention to the parts of the city where we're not seeing as much vaccine uptake. And we are expecting shortly to be able to truly move ahead with saying, those who are over 65 will be opening up our mass points of dispensing, our vaccination sites for you. We'll be making appointments available in our pharmacies for you. And importantly, we are working to get your doctors enrolled to be vaccinators. Just a week and a half ago, I could count on one hand the number of outpatient providers that we had enrolled to be vaccinators. We're up to more than 275 now and growing every day. We continue to grow our focus on long-term care. We have more than 275 of those facilities that are continuing to roll out vaccine. Progress is good here. I want to be very clear, there is no vaccine being wasted. I keep hearing misinformation about that. We also want to make sure all vaccine is being used, but that we continue to make sure our healthcare workers get the vaccine that they need and that they deserve. So we're excited about moving forward, but I want to be clear that at this time, people over 65 do not need to register anywhere. If you want to make sure you've signed up to get our notifications for when it is your turn, you are welcome to enroll in Chai COVID Coach, as we've been promoting all along. We will let you know when there is the opportunity for you to be able to, when we are more able to fully move into this next phase. We're excited about the way the rollout has been going, and looking ahead, we will continue to focus on safety, improving efficacy, and making sure people have the information they need, so when it is their turn to be vaccinated, they'll be vaccinated with confidence. And with that, I'll turn it over to Alderman Curtis from the 18th Ward. Thank you.
Good morning. Good morning. In the past few weeks, I listened to a lot of skepticism in the black and brown community about this, taking this vaccine. This vaccine is proven to be safe for all ages, races, small or huge body frames. The sooner we take this vaccine, the sooner we get back to a normal lifestyle. The sooner we get back to block parties. The sooner we get back to our family functions. I want to thank our mayor for bringing this distribution to our community, and remember, we're all in this together. Thank you.
Good morning. I'm Juan Salgado, the Chancellor here of City Colleges of Chicago, and I'm going to share brief words in English, but more than anything, we'll share some words in Spanish to translate what has been said here today. I want to really start by, thanking our leaders, Alderman Curtis, for your work in this community, and especially to Mayor Lightfoot and to Dr. Arwady. This is, I think, a time where we need to be grateful for leadership and the work that leadership is doing in order to keep us safe. But for leadership to be effective, we too need to lead. As heads of households, by stepping forward when it's our turn, and getting this shot, getting this vaccine, making sure that, as Alderman Curtis and Mayor Lightfoot and Dr. Arwady have said, that we can keep our families and our communities safe, and we can get on to the business of normalizing our lives. City Colleges is committed to supporting our city's response, and we are grateful that the mayor and Dr. Arwady have looked to us at Malcolm X, now here at Daly College and AVI, soon to be at Olive Harvey and Kennedy King and Truman College. We are community colleges embedded in our local communities that serve students that are from our local communities, and we are honored to have this opportunity. We are so grateful and thankful to all of the healthcare workers, all the essential workers. I mean, this has been a challenging and trying time for everybody, but especially for them that have been on the front lines. And the fact that they will be able to get this vaccine because of these centers and all of the efforts our city is taking is wonderful. Let me just share a few words in Spanish. La próxima semana, Chicago tendrá un total de 6 puntos nuevos de vacunación masiva para aumentar la distribución de la vacuna contra el coronavirus. El primer punto PAD de Chicago abrió en Malcolm X College el 28 de diciembre, que fue seguido esta semana con la pronto apertura de puntos en el Instituto Arturo Velázquez y ahora en Richard J. Daly College. A mediados de la próxima semana abriremos puntos en Olive Harvey College, Kennedy King College y Harry S. Truman College. Estos puntos de vacunación ampliarían la distribución de vacunas en Chicago y a través de la fase actual, conocida como 1A, que incluye trabajadores de salud no hospitalarios y comunitarios. Pronto ampliará nuestro cubrimiento mientras pasamos a la siguiente fase de distribución 1B. Después de una exitosa distribución de vacunas a nuestro personal de atención médica de primera línea y los residentes y personal de nuestras instalaciones de cuidados a largo plazo, esta nueva fase 1B dará prioridad a los trabajadores en industrias esenciales, incluyendo el personal de servicios de emergencia, personal con alto riesgo de enfermedad grave por COVID-19 y personas de 65 años de edad o más. Sin embargo, como han dicho el día de hoy, es fundamental que recordemos que el hecho de que más habitantes de Chicago puedan vacunarse no significa que debamos bajar la guardia. COVID-19 sigue siendo mortal. Incluso estando vacunado, aún se puede transmitir la enfermedad a quienes no lo están y potencialmente propagar esta enfermedad aún más. Debemos seguir continuando las normas que nos han enseñado a través de estos días. Use tapabocas, practica el distanciamiento social, lávese las manos con regularidad. La alcaldesa Lightfoot también está pidiendo al gobierno federal por un aumento en la cantidad de vacunas designadas para Chicago y por un incremento en el apoyo financiero para las personas y el gobierno local. Para obtener más información sobre la distribución de vacunas, visite chicago.gov/coronavirus. Muchas gracias. ¿Habrá preguntas?
Before I take your questions, let me also just add that the people who are here today that got vaccinated are all part of the Southwest Organizing Project, also known as SWAP. SWAP has been part of our effort that we launched weeks ago called Protect Chicago. Literally neighbors who are going door to door in their neighborhoods to help bring information about how residents can protect themselves against COVID-19. And I would be remiss if I didn't say thank you so much to all of you for all you do. Greatly, greatly appreciated. So thank you. And now happy to take your questions.
Hello, my name's Jenna Barnes. I'm a reporter with WGN. If people see these mass vaccination sites opening in their neighborhoods and they qualify, how do they sign up? How do they get in?
Well, what they should do is go to our vaccination website, which is chicago.gov/COVID-VAX. That's COVID VAX. And then they're going to find information out about when we're moving into a particular phase that affects them. And what we're going to try to do, obviously, is have people sign up. I've watched with great distress what's happened in other parts of the country where people are lined up for hours and hours, particularly seniors, waiting to get vaccinated. We're not going to do that here in Chicago. We're going to have an orderly process, and we will be communicating with folks. They'll be able to sign up ahead of time to get their vaccination. But we just want to preview what's coming next. And again, we're going to still be in a healthcare setting in this initial phase of 1B, and encouraging hospitals and other providers to identify their patients, as Dr. Arwady said, that are 65 or over, particularly those that are most at risk, and make sure that they're prioritized in this next round.
Our next question comes from Kai Martin, NBC5. Can you talk to restaurant owners about any hope they have for potentially reopening their dining?
I am very, very focused on getting our restaurants reopened. If we look at the various criteria that the state has set, we are meeting most, if not all of those. So that's a conversation that I will have with the governor, but I want to get our restaurants and our bars reopened as quickly as possible. I said this the other day, you know, the restaurant setting in particular, highly regulated. We have inspections on a regular basis. They've gone above and beyond to put in mitigation controls inside of the restaurants. They are going to be one of the safer places. And what we've seen since the restaurants were closed down is a couple of things. One is people going into private spaces, whether it's hotel rooms, whether it's underground venues, and having these parties with no mask and putting themselves more at risk. If we have people and give them an outlet for entertainment in the restaurant space, in the bar space, we have much more of an opportunity, in my view, to be able to regulate and control that environment. People are engaging in risky behavior that is not only putting themselves at risk, but putting their families, their coworkers, and other ones at risk. Let's bring it out of the shadows. Let's allow them to have some recreation in restaurants, in bars, where we can actually work with responsible owners and managers to regulate and protect people from COVID-19. So I feel very strongly that we are very close to a point where we should be talking about opening up our bars and restaurants.
Days, weeks? How soon could that happen?
I'd like to see it as soon as possible. But again, I will follow the public health guidelines. We obviously have to do this in conversation with the state. But I think we are at the point where we need to be talking about the when and not if.
Thanks. The next couple of questions are for Dr. Arwady.
Yep.
These come from Kelly Bauer, Block Club, Chicago. Does Chicago have any concerns about continuing to use curative tests after the FDA warned they could return false negatives? LA has stopped using them at some sites.
I want to be just clear on one thing. The great majority, which is the city of Los Angeles, continues to use these curative tests as are being used around the world, around the country. There was a decision from some small number of sites in LA County that is a different operation than what we're doing here. But to hit on the root of the question, obviously we follow very closely everything related to any of our testing and anything that comes out from the FDA. There was an additional communication from the FDA where Curative was hoping to be able to expand its ability to use these tests. They were hoping to be able to use it in a way that did not have to be monitored, that somebody could do it, for example, at home. And the FDA said, no, we're not going to grant you that extension of your emergency use authorization. And they emphasized further that the best way and the the best use for these tests is for people who have symptoms of COVID. But if you look at the way the labeling is actually done and the information that we send to everybody who registers for these tests, it does highlight that it can be used in the way that we are using it with appropriate information. And we have looked closely, and our rates of positivity, the way that these tests are performing in these neighborhoods is absolutely in line with what we are seeing in the other surrounding areas. We feel very confident based on what we've seen at this point related to this test. We do not have plans to move away from using it unless additional data were to come out.
Okay. Among hospital workers who are hesitating to get the vaccine in Chicago, can you estimate what proportion are medical workers, like doctors and nurses, versus non-medical?
So I'd like to highlight first that we are not done vaccinating hospital workers. We heard a lot of hospital workers say they wanted to watch and see their colleagues get that second dose, know that everything looked well before they were feeling like they wanted to step up. And we've just started second dosing in this last week. And so we are very strongly encouraging all of our hospitals to do another round with their own staff. We have anecdotally heard that what we see track is that the biggest predictor for whether somebody raises their hand first for getting vaccine is actually level of education. That's true across the country. That's true here in Chicago. And so broadly, I would say we have seen some of the doctors, for example, or the nurses, the people maybe with some more of education and who also have been closest in a lot of cases to direct care to COVID patients, being first to raise their hands. But we want everybody working in these hospital settings to be vaccinated ideally, and to have the information to be confident in that. So we have seen lower uptake among some of the support workers, whether we're talking about the people working in environmental services or cafeteria, dietary, or security in these hospital settings. But I don't see that as a major problem. I see this as now it's a chance to really ask again, now that we have excellent safety data locally here, where we've seen so many people getting vaccinated. So I don't have an exact breakdown because we don't report by occupation, but what we're hearing anecdotally and the way our maps look in Chicago is very reflective of those folks just being first, but we're not done.
Gotcha. The next question comes from Alice Yin. Her question for you: the state of Illinois estimates 850,000 residents are eligible for phase 1A. How many Chicago residents qualify for 1A?
For 1A?
For 1A.
Okay, so phase 1A, just to be clear, includes our long-term care facility residents and staff. We have 58,900 of those, and those doses have been set aside. We've received, in the first month, we had to set aside enough vaccine for all of those long-term care facility residents. We can't touch those. In the other first month, we received just under 100,000 other doses. We've estimated that approximately 400,000 other healthcare workers are in this group. So I'm not quite sure where that 800,000 number is coming from, but we are not through those 400,000. And so we expect to be soon. We're getting thousands and thousands of people vaccinated really every day here. But that is the estimate and that is based on surveys. It's not just the people who live in Chicago, it's the people who work in Chicago.
Okay, thanks. Next question is from Carla Leal with Telemundo. Will the COVID vaccines that are currently being rolled out be a part of a once-in-a-lifetime two-shot process, or will these vaccines be an annual occurrence like the flu shot? Yeah,
we don't know the answer to this question yet. At this point, the protection looks very, very good with 2 doses of this. Most of the experts expect that this would, at this point, be a more long-lasting vaccine than like an annual flu vaccine. But it all depends on what happens with the virus. If we were to see a lot of mutation in the virus, for example, like we see in flu every year, that's the reason we have to do a flu vaccine new every year. We make a new virus to match the different strains of flu that are circulating. The good news for COVID, although this most recent variant has gotten a lot of attention, we've not seen an amount of mutation that has threatened any of the vaccine that is in production. So at this point, with the amount of mutation that that we've seen. We expect that this would probably be more long-lasting. But the good news is, because of influenza, if this were to become an annual thing, we actually have the capacity to be able to do that.
A few questions from Becky VV with WBEZ. How do I know where I can go to get a vaccine? When will CDPH share a list of the 250 locations now administering them?
So again, when there is an opportunity for individuals to be able to sign up for vaccine themselves, we will be sharing the website, the process for them to be able to do that. Right now, those providers that are receiving vaccine are primarily vaccinating our outpatient healthcare workers, or if they have vaccine that is going unused, they are able to start vaccinating their existing patients. For example, patients who are in the hospital right now and might be leaving to go to a long-term care facility, or the highest risk patients that are being seen in an outpatient setting. So this will be shared. I'm not trying to, not share what's going on, but I don't want people to get the impression that they can sign up for an appointment just yet. When it is available to sign up for an appointment, which I expect very soon, we will make that available through the website. And again, if people are really feeling like they want to sign up somewhere, they can sign up on Chi COVID Coach, and we will communicate to them when that opportunity is available.
When the opportunity is available, will locations allow walk-ins, or will you need a referral from a doctor?
So in phase 1B, all of our vaccinations are going to be by appointment. We've seen clearly around the country that this is the way, first, to make sure that vaccine is being used. Second, that we're not having some of these visuals like we're seeing in some states of people standing in line for hours on end, particularly in cold Chicago. I would have real worries about safety beyond COVID safety that go along with that. And we have the opportunity then to direct vaccine around the city related to where we are seeing demand and people signing up. We will be directing additional vaccine, of course, to the parts of the city where we're seeing less vaccination, but we have to make sure that the demand is there to be able to do that. So just as phase 1A has all been by appointment, even healthcare workers cannot walk into these pods. We have been sending out the codes. They have then been registering for the date and the time and the location that works for them in 1A. We will be doing the same thing when we more formally move into 1B. People will have the opportunity to sign up first, ideally, through their healthcare provider, otherwise through pharmacies, through our points of dispensing, and so on.
Got it. Okay, the next question comes from Alex Nitkin from the Daily Line. This might be a question for the mayor. When are you expecting to receive the funding Congress has approved last month to help vaccine distribution, and how will the city use that money?
Well, it's not enough. This is the first thing I'm going to say. Some of the formulas on distribution, I understand it, are still being worked out. So we hope to hear and get guidance from the U.S. Treasury Department soon on that. But we're anxiously awaiting the receipt of the monies that came through some of the formulas, both to support public health, schools, transportation, but a lot of that, the release of that information, we're still pending guidance from the Treasury Department.
And a follow-up from this reporter, now that we know Democrats will have full control of the Congress, what are your hopes in the way of new direct funding for local governments that can make up for COVID-related revenue shortfalls, and can you give us a number?
I hope that it's the first bill that gets to the President's desk. I think something along the lines of the HEROES Acts that were passed by the House of Representatives makes a lot of sense. Obviously, portions of that were covered by the stimulus bill that were passed right before the holiday. But as you know, there was no direct funding for state and local governments, and that's got to be a top priority for this new administration. I hope that gets to the President's desk forthwith.
Thank you.
Thank you.